Right. Now, stimulated in late childhood by a cascade of endocrine changes, processes of bodily growth and sexual and reproductive maturation associated with puberty are accompanied by a series of emotional, cognitive and behavioral transformation that mark the period of early adolescence. And coming with the territory is teen pregnancy and childbearing, bringing substantial social and economic costs through immediate and long-term impacts on teen parents and their children. And that is what we endeavor to explore this morning with Ms. Veronda Kuboka, a program officer, and Victor RASUGU, senior consultant, both from NAYA, which is Network of Adolescents and Youth of Africa. From here henceforth, we shall call it NAYA. Welcome to both of you.
Thank you.
Right, let's start now with the elementals and as we learn about NAYA. Victor, maybe to start with you. Tell us about NAYA.
Well, Network for Adolescents and Youth of Africa, NAYA, was founded in the year 2001 by a group of young people from Kenya, Uganda, Ethiopia, Malawi, Sudan, Nigeria, Benin and Cameroon. And the key mandate was to advocate for the implementation of policies and legislation on adolescent sexual and reproductive health and rights. When you look at the context of Africa, we are having a bit of negative indicators in terms of adolescent sexual and reproductive health and rights. So, for example, if you look at Kenya, we're talking of young people between the age of 16 to 24. They account for over 50% of new HIV infections. So this was some of the predisposing factors that led to the formation of NAYA. So it's basically a regional network that is led by young people, and our exit age is 35, so by 35 you leave, yes.
Right. Venoranda.
Yes.
Unique name. Huh? Right, tell us now, you know, the most challenging thing is really coming up with information and health services, you know, to enable the boys and the girls on how they can conduct themselves, especially during the adolescence age. And this, as according to the international standards, most countries do not meet. You as NAYA, how have you been able to maybe navigate these challenges?
Okay, one of the major things we've been able to do as NAYA Kenya is have the ability to integrate the use of technology. And we are currently running a lot of media advocacy programs countrywide. So we've been able to come up with radio programs that are youth-friendly, that enable some of our youth advocates reach out to other young people by disseminating information and sensitizing the general public on reproductive health issues. Yes.
Now, considerable also, I think, research has been done on how the girl child, especially during the adolescence age, should be given that information. You know, sometimes it's such a shock to them, you know. They're just thrust into that age and they're wondering, well, seriously, there are a lot of changes happening inside me, but I do not know how to be either a child or a grown-up woman. Where am I supposed to be? And you're left out there, you know. How have you been able maybe to come up with a system on trying to lure the girl, so to speak, into the process, you know, into this age of the adolescence age, and them to accept themselves and accept the changes that is happening within them?
One of the key things we focus on as NAYA is enhancing the capacity of young people, and we do that through trainings and the mentorship program, and we give correct and consistent information around the sexual health and rights that will enable them to make informed decisions. But you agree with me that it's a nationwide challenge, and not only in Kenya but in other Africa countries. And the other thing is we look at what are those bare minimum that needs to be introduced into the policy process, so that again we have a guideline and a basis for disseminating the same information. And in so doing, we reach out to the young people in school, out of school, through those clubs that have been formed out of school, by other civil society organizations out of schools, because we are a membership-based organization. So we have over 40 youth-serving organizations coming together. So then we empower other young people, and then we now use them as change agents to reach out to their peers.
Right.
Yes.
We also know, of course, the growth of the adolescents. It does not just respond to the brain changes, but also have other hormonal influences.
Yes.
Of course, we have the nutritional states and also educational, emotional. How are you able then to give it, maybe in the continuum of that growth, to give it a holistic approach? You as NAYA, of course, you're not just focusing on teaching these children on how those hormonal changes are happening in their bodies, but also you're giving maybe a comprehensive educational curriculum. Do you have any curricula that you've developed, or how do you go about?
Okay, I would personally say that we've been able to do a lot of in-school programs.
In-school programs.
And through this, we've been able to reach out to the young people and just help them to create self-awareness, for them to be able to understand exactly who they are. Because it's equally important for you to, in order for you to get to where you are right now, you really have to know exactly who am I. So we've been able to create awareness and help develop leaders and even establish peer clubs to enhance sustainability and growth on the same.
Right.
Yes.
Maybe another key issue is incorporating. Are you just working solely by your own, or also you're incorporating other stakeholders, maybe the churches and all? What is your approach?
I mean, we've taken, we know that we cannot achieve this on our own, so we have other civil societies, we have the media who play a very key role, we have the religious leaders who have come on board, then we have the learning institutions, and also we have young people. So we work as stakeholders, and we also work with the Ministry of Health. For example, if you look at the Ministry of Health, they now have a program entitled Invest in Adolescence, which aims at training young people to be able to advocate at the country level. So we work with numerous stakeholders for us to be able to achieve our goal and achieve the goal that is in the adolescent reproductive health and development policy of having a conducive environment where young people can fully enjoy their reproductive health and rights.
Right. Yes. And what do the young adolescents, especially in different geographical locations and socio-economic settings, what are they really learning about the gender roles, as far as maybe adolescence is concerned?
Okay, one of the major things that we are educating the young people on is unplanned or teen pregnancy. There's a great aspect of life skills, and particularly for the girls, them having the ability to have the power of negotiation, development of good communication skills, and enhancing their capacity on decision-making process. Then apart from that, just as what Victor has said, we are greatly working around with the religious leaders, because we realize that most of them don't talk openly about sexuality issues. So we also have a component of sexuality and religion. There's an aspect of gender and relationships, and also mentorship, which is very key for us.
Right,
yes.
which bring another very ticklish issues as far as the adolescence is concerned, the contraceptives. Yes. Of course, it's a given that right now we cannot be just putting our heads in the sand and say that our children are not really they're not aware about sexuality, and they're not having sex. It's true they're having sex, and what do we do right now that they're having sex? Should we just turn away and assume they're not having sex? The issue of contraceptives really come firmly then on the table, and of course we are torn between the church and the parents. Should they or should they not use the contraceptives? You as an organization, what is your take on this?
One thing is access to information, access to contraceptives, and the choice you make about your reproductive health are some of the things that if you look at the guidelines by International Planned Parenthood Federation, they're some of the basic minimums that you can really ask from a young person. So our take as an organization is the young people have a choice to use the contraceptives, but again we have to be careful that there isn't that misuse. So the young people need correct information on how and when to start using these contraceptives, and this if you go through the national guidelines for provision of youth-friendly services, already the government recognizes this, yeah, that not all young people are abstaining, as you're putting in the bar, and we can't put our heads in the sand and say we're not going to do this. While we are having a population that is increasing at 1 million a year, and again we're having a situation where every day 21 women are born due to maternal mortality, and a great percentage are young people below the age of 24. So we really need to know what do we need to do then to reduce maternal mortality among adolescent youth. And that's why we appreciate the concerns of the church, yes, but then there's also morality and there's also reality, and we have to live with the reality on the ground. Yeah.
Well, I thought the issue, because now, of course, they go to buy the P2
Yes.
and they get them from the chemist.
Yes.
Then what should be the role then of maybe the people who should be wise on this, if they see maybe this is a kid who's coming there? But because nowadays it's a bit tricky, because you can't really tell the age of a girl, because all of them, they've taken a button, blue band and Cerelac formula, and they yes. But what should be the role maybe of the people, of the chemists, or what do you as an organization do in terms of working with also the health providers in terms of using those contraceptives?
Okay, I think one of our major responsibilities as NAYA Kenya is to be able, one, to make sure that all young people access correct information regarding reproductive health. Two, they have access
and what is the correct information?
Correct information is information that you need, information that says reproductive health is this and this. These are the components, and this is exactly what.
Maybe
what
you can break
want.
it down for us. Then we get to know what is all this that is encapsulated there. Because we beat around and we normally say yes, reproductive health. But what give us the brass tacks of that? You know, let us get down to the elementals and we learn what is really the reproductive health that we're talking about here.
Okay, reproductive health is basically, this is a state of physical, mental and social well-being, and not merely the absence of a disease. That's the basic definition given by World Health Organization. So, and it also looks at how do you express yourself, your emotions, do you appreciate yourself as being beautiful. It goes also around your image, how other people, and how you look at other people. So that's the entire thing about reproductive health. So then that means you have also the reproductive health and rights, which looks at in terms of access to information, the choice you make, privacy when you go into the healthcare system, affordability of the healthcare that system that you go to, and so this is what is encapsulated in reproductive health DIBAL.
Right.
Yes.
Now that they're on holidays right now, what are you as NAYA doing to try and help these adolescent children at home right now? Do you have any program for maybe vocational something during the holidays?
No, what we are currently running, we are running radio programs, radio shows on particularly ECN Radio. That's a community radio station. And Vibes Mtaani, it's an online radio, plus Truth FM, which is a Christian radio station. So we have sessions every Friday for a period of 1 hour, just to be able to connect with the young people who are on holiday. And again, basing it on what we've mentioned, just empowering them on reproductive health and right issues. If they have matters of, maybe they're suffering from STDs and STIs, where do we refer them? Where do we connect them to the right facilities so that they can be able to get the right medical services and treatment? Then just being able to sensitize them and making sure that we demystify some of the myths and misconceptions they have regarding reproductive health and rights. Because as Victor said, reproductive health and rights is more than just sex and sexuality. It's just a whole comprehensive bunch of things. There's that aspect of sex, sexuality, how I look at myself as a sexual being, and also being able to understand and know who exactly I am. Yes.
Now you have networks from other countries, as you mentioned, Ethiopia. What are you learning from these other networks and the countries?
One of the things is, I have to say, Kenya, we are way ahead of the other countries. That is in terms of the policy environment and in terms of the dialogue and advocacy space, because, for example, if you look at Section 43(1)(a) of our Constitution, everyone has a right to high attainable standard of health, including reproductive health. In Ethiopia, you cannot even advocate. There are aspects of advocacy that has been banned, for example, in Ethiopia. So Kenya, we are able to talk freely, we are able to engage the policymakers, and a lot has been done, but more needs to be done in Kenya. Other countries also do not have the policies that take cognizance of adolescent reproductive health. Kenya, we are ahead in that. So our big challenge now as a nation is implementation of the policies. I think in Africa we have the best policies, whichever.
But implementing that is a crippling factor.
Yeah, I mean, we have the best policies, but the implementation is very remote. So then our key focus now is how do we advocate for the implementation of these policies, and how do we ensure that there is adequate budgetary allocation for the implementation of this policy, because budget is also another big issue that when it comes to budget making process, we go to Abuja as Kenya and say 15% of our national budget will be allocated to health. Then we see the ministerial statement on the budget. You have 5.6, that is 85 billion Kenya shilling. I mean, you're way above. You're almost 9.4% below. And that means if we don't really invest in these young people, then we'll have very negative reproductive health indicators. As I've mentioned before, we cannot really look at these issues rightly. When we have a nation where 7 out of 10 girls and 8 out of 10 boys have had sex before the age of 20, then that really means a lot has to be done. And we must invest as a nation in this category, because only people who are 10 to 24 years account for 36% of our total population. That means we are having a very youthful population, a population that needs a lot of guidance, a population that needs mentorship, a population that needs very deliberate efforts to invest in them, to enhance that the ability to be able to be productive and contribute towards national development now and in the future. Yes.
Right. So how have you been able then to push the envelope? As you said, implementation, it's a big stalemate where you have all these policies, but now implementing. How have you then, as an organization, been able to push this envelope?
One of the things is we work with the other government agencies. For example, the National Council for Population Development. They are a very proactive government agency in terms of policy implementation. And